Much everyone who's dialing in, and welcome to our first edition of Charm Chats. We hope the first of many. And really, we wanted to start a series to help demonstrate and share a bit more information about the type of work that the companies we work with do, and really give them a profile that they can then share. So today, on our first session, we're very lucky to be joined by Deborah Gael. Deborah is the co-founder and chief of operations at Koolboks. We've done one loan with Koolboks already, and we have a second one we're currently raising for. Koolboks is actually on a mission, and they say to make solar refrigeration affordable and accessible to everyone. So welcome, Deborah. Thanks so much for joining us today.
Thank you so much, Gabriel. Thank you for having me. Thank you.
No problem at all. So it would be great if you could just kick us off and just really introduce yourself and tell us a little bit of your history. Like, what did you do before founding Koolboks?
Okay, thank you so much. So my name is Deborah Gael. I'm the co-founder and director of operation at Koolboks. And before co-founding the company, I used to work as a human resources business partner. So basically, I was in charge of defining and implementing HR strategies in the companies I was working for. So nothing to do with the solar industry and nothing to do with the cold chain industry. So I basically learned everything on the spot.
Yeah, awesome. No, it's great. And I think a lot of it has trickled through in the way the company's culture has developed as well. You know, when you speak to any of the member of the Koolboks team, it's great to know how that's kind of fallen through to make everyone have such a nice team, really. But it'd be great to give also then, I suppose, the history of the company, because it's quite interesting because you started from a very niche product in France, which was your cooler, and hear how that's developed from your Genesis story really up till now would be great to share.
Yeah, sure. So I'll try to make it short and concise. So basically, we created the company in 2018, and our first product was a smart cooler that we called the Koolboks. And we did quite well. It was a fun product. We sold it over Europe and the Caribbean. And after 6 months after the launch, we decided to do a survey. And we found out that people actually wanted a solar-powered cooler. So we went back to the drawing board, and while doing a lot of research and development, we stumbled upon a great technology, which is called ice thermal storage. So we were like, okay, this is great. Maybe instead of applying it to luxury, maybe we should use it for the betterment of mankind. Maybe we should use it for people who do not have the luxury of having cooling. So this is exactly what we did. So as you know, today in sub-Saharan Africa, which is our target market, over 700 million people still do not have access to electricity, and as a result, lack access to refrigeration. Today, every year, 40% of food is wasted due to lack of refrigeration, and 3 in every 10 children die every year due to vaccine spoilage, the result of cold chain being disrupted. So we were like, okay, there's an opportunity there. We want to be a part of it. We want to do something. So naturally, we went ahead and we created the Cool Home, which is an affordable off-grid solution that is able to generate continuous refrigeration for up to 4 days, even in the absence of power and even in the absence of limited sunlight. And we were able to do that with the technology, the ice thermal technology. So basically, the whole concept is to store energy in the form of ice instead of storing energy in the form of batteries. So that's for our product, the Cool Home. And then we went even further. We also launched a vaccine fridge, the Koolboks. Our CEO and co-founder, Ayula Dominique, is a pharmacist. He worked in the pharma industry all his life. So it was very natural for us to also propose a solution for the healthcare industry.
No, I think it's amazing. I think it's so great to see that kind of transition from a real luxury product for people going to the beach, into something that can really benefit millions of people. So I think it's really incredible. And I suppose a question that really gets us into the meat of the discussion is around what point when the pandemic hit, did you guys realize that there was potentially a viable business with the Carebox? Like, I know you guys are going through your World Health Organization certification just now, but it'd be great just to understand, you know, how that all kind of fits together into the company.
Yes, you are right. We are in the process of finalizing our certification with WHO. So finger crossed by May, June 2021, we should be officially certified. Regarding, thank you. Regarding the Careboks, I would say that definitely we saw, a huge rise, in demand mid 2020, right in the middle of the COVID crisis. I would not say that we were surprised, but that's something that we were expecting. 98%, I would say, of our customers today are based in Sub-Saharan Africa. And the demand we are receiving, every week, every day was also coming from that same region. Sub-Saharan Africa, the electricity is unreliable, off-grid, weak grid, and on top of that, temperature can sometimes go as far as 40 degrees, 45 degrees. So when you put that together, this is definitely not the right combination for storage of vaccine. It's hot and there's no electricity, no power to power the cold chain equipment. So we had to do something, and the Koolboks is a great product to answer that need. The Koolboks is an effective, affordable solution. We offer 24 hours refrigeration with our ice batteries. The product is energy efficient and also very affordable because we actually integrated the PayGo device, the IoT PayGo technology, so our customers can pay on a weekly, even daily or monthly installment. So very affordable.
Yeah, I think it's fantastic, and it's interesting to see again the product transition, I suppose, right? You kind of already had a very efficient and affordable refrigeration unit, and it was just really adapting it to the scenario at hand that makes such a great product. And I just guess when I was doing some research for this, I just took some statistics just to help everyone really understand how big of a problem is it to have a lack of affordable refrigeration when we look at the face of kind of the COVID-19 vaccine rollout. So I'm just going to quote a couple of stats, so I hope everyone doesn't mind. But so according to a 2020 off-grid appliance market survey that was run by the Efficiency for Access Coalition, to deliver the COVID-19 vaccine to 60 to 70% of the world's population, so a huge number of people, so there's about 4.7 to 5.5 billion people, new cold chain equipment is going to need to be rolled out on a massive scale. So it's really quite startling when you think about how we're already seeing in the more developed countries the rollout of the vaccine and really take these things for granted. And so it would be great, I guess, also for us to take a step back for a moment, because I know we're using a lot of jargon sometimes. So let's start just kind of reframe it and define what do we actually mean by cold chain within the context of what we're talking about. And especially, I suppose, if we can understand a little bit more of some examples of how that it like practically limits people, and just why is it lacking, especially in the West African context where I know you guys are starting the Careboks kind of piloting. Why is that? And it'd be great to understand a bit more.
Okay, so maybe I should start with the definition. So the cold chain actually refers to managing the temperature of perishable products. So not only vaccine, but also food. So I'm referring to meat, fish, milk, vegetables. The idea is with the cold chain to maintain quality, but also safety for the end customers by making sure that throughout the process, the temperature are kept at the proper range. So that would be the definition. Now, to give you more of a concrete example, that's an example I like to use, when I explain the whole cold chain concept to people. Pharmacists in Nigeria being today our focus market, at night and over the weekend, pharmacists are scared. And the question is why? Well, basically because they are scared of the fact that, they can take the power at any time. Like, let's say on a Friday, I leave home to go on a weekend, and I'm scared that, you know, my vaccine are there in my shop, but at any time we can have a power cut. And if that happens, it means that my vaccines are wasted. So some of them, pharmacies, what they do, they actually take home some of their vaccine in a small cooler. They will put ice blocks, and like that, they have more control over the cold chain, and they can make sure that the temperature is at the right range. So that's one example. Some of them also will use generators, you know, those big systems, very noisy, very pricey, very dangerous for the environment, very dangerous for their health. But they are just trying to make sure that their system is powered and that they can have cooling 24 hours. So that's the kind of, you know, challenges that healthcare industries are faced with in sub-Saharan Africa.
Yeah, it makes sense, and it's, you know, it's really hard, I think, for a lot of us to comprehend that, even as a concept. You know, my mum was a GP, and if she had to bring home vaccines to store at home in a cooler, it just does, it's so alien to the way
sense,
we
right?
operate, you know.
Yeah.
And I guess when we look at then the COVID vaccine and how that's looking and the different types of vaccines out there, how does that make this, you know, of such a critical importance to ensure that no one's left behind and people do get vaccinated? Like, how do we bring that into the relevance of like the opportunity as well, I suppose, right now for the care box?
Yeah, I mean, even more important today with the COVID, for instance, the Pfizer vaccine needs to be kept at minus 70 degrees. I think the one from AstraZeneca is between 2 and 8 degrees. So all those vaccines needs to be kept in very cold conditions. So at that point today, there's no other option but to have a vaccine refrigerator, whether it's, you know, with your generator, which is not so good for the environment and for your health, but it's, you know, good to look at a solution like the Koolboks, where the product is solar powered. We are using green energy, which is very abundant in Africa. The product is reliable, and we can actually go as low as minus 25 degrees.
Okay, that's amazing. And so does that mean there's going to be a limit on the different vaccines that are going to should come into the continent, and which ones, to make it actually possible to vaccinate everyone?
I would say yes. I would say that the African government will probably go with the option of 2 to 8 degrees. But again, that's just my opinion, but I think that it's going to have an impact, definitely. Yeah.
Yeah, that's so great. And I realized, I mean, it's hard to understand the importance of the scale you guys will need at as a young company, but I suppose it also presents quite a lot of exciting opportunity in the face of having right product, right time is really everything you need in a good business. And I guess it would be great to understand more of both sides of kind of how your model works, from the cooling as a service, and also maybe some details around, I know you're piloting this with Delta State in Nigeria, and maybe you can share how this pilot's working out and the learnings you're taking from it, because I think it's great to see that this isn't just, it's not just a theory, right? You guys are already putting it into practice, working on getting it certified so that it can roll out as quickly as possible and be really present right now.
Yes, we are actually running a pilot in Delta State in Nigeria. That's in the north of the country. We are piloting a few units of our Koolboks over there in primary healthcare centers. The thing with Delta State is the fact that most people live in rural communities, and with very limited access to health facilities. And when they do have access, those facilities are not properly equipped with cold chain system equipment.
Right.
So right now we are piloting our Koolboks with some facilities, and we are also deploying the cooling as a service business model, which we've been supporting by Basel Agency for Sustainable Energy. It's an affiliate of the United Nations. They are based in Switzerland. and we've been incubated with them since early 2020. So we are really, pushing this business model to the healthcare industry. It's quite advantageous, I would say that number one is the fact that people can pay on monthly basis. So by doing that, we completely eliminate the huge upfront cost often associated with the purchase of those big systems. It's quite expensive. And also, second advantage is the fact that we offer technical support. So the Koolboks team is in charge, is responsible for all the operation with the system and the maintenance. And we make sure that, everything is working perfectly fine. We go and check the system every month. And we also integrated in our system a temperature monitoring device that gives us data on the temperature inside the refrigerator. So at any time from a distance, we know what's going on. And if there's any issue, we can just, give a quick call to the doctor, the nurses, and let them know that we need to come and we need to fix the refrigerator ASAP.
It sounds fantastic. And what have you learned so far from the pilot as it stands? Have there been any changes in the business model, or is it just proving that everything's working well?
I'll say that so far so good. The feedback has been quite positive. The system is working well. The technology is working well, and the business model is well received as well. I mean, to be able to pay for your system on a monthly basis definitely make a huge difference for those health facilities, definitely.
Okay, perfect. And if anyone has any questions, I hope you can put them in there as well, and just use them either in the chat facility or a way to put Q&A. We've had one question come through. I don't know if we have a necessarily an answer for this, Deborah, so I'm going to put you on the spot for one moment. But it's asking us, really looking at when Nigeria has a very challenging electricity supply. Regular blackouts are frequent occurrences on a daily basis. And is there any way that you're working with other partners to resolve those issues? So whether it's the warehousing, the trucking, or is this just something that's not really inside your business model and you really focus on the storage at the end point?
Okay, so I'm not sure I got the question, but I'll try. For the part regarding the logistic, we work with distributors in Nigeria. So we have partnership with distributors present all over the country. So they are in charge of that logistic, transportation, and all of that. And we focus on our business, which is making sure that we provide efficient solution.
Great. No, that makes sense. And so I guess, is there anything else that you'd want to share around the challenges that you foresee in the rollout of the Koolboks? What asks do you have as a business? What are you going to need other than capital to be able to scale facilities? So any investors on the call, there's definitely going to be a big need. But what else do you need in terms of infrastructure, enabling environments? Is there any regulations? What would you look for ideally to make everything plausible to scale in a very rapid pace to really service the COVID vaccine requirements?
I think that the public sector, government, and the private sector needs to work hand to hand to make the distribution faster. I think that if we are able to do that, everything should be smooth. And then yes, as you said earlier, funds, definitely funds. I mean, this is
No, it makes sense, and I think it's an ongoing challenge, but maybe there's some hope with it that we've seen the pace that the vaccine itself can be rolled out. And so, hopefully when the right people get together with the same focus and goal, you can see things happen at a much more rapid rate than we would otherwise see in normal situations.
Right.
We've had a good question come in from Chris, and Chris has asked, what's the target for the pay-as-you-go Koolboks? Is it private sector that the focus is on? And he also mentions this obviously an exciting innovation that could remove some of the barriers from the government tenders. So really looking at how you make this as affordable as possible to the lowest common denominator with the ability to pay over time, just to explain the question, I suppose. But really, who's your target market now? for selling it with a cooling as a service model?
Are we talking about the Koolboks or the Cool Home or both?
For the care box. For the care
The
box.
Koolboks. For the Koolboks is mainly strictly, I would say, the healthcare industry. So we are looking at pharmacies, hospitals, healthcare facilities. I mean, strictly the healthcare industry. We also have the Cool Home, which is more like productive use, domestic use. We are also working with women fish traders, people having small businesses, selling drinks, selling meat, and all of that. So we are trying to approach the market with open mind and try to provide a solution to everybody.
Yeah, I think it's great to see the way that you can actually take an innovation that was previously seen as far too expensive for the majority of the market, and how you're making it something that can actually be affordable to much more lower income customers, be that private market sector or just individuals. As you're saying, the market fish traders, it really, it can be a game changer. And I think it's something that's not to be underestimated. And when we make a parallel, to the productive use sector, for those in the off-grid sector, productive use is really a big buzzword, and I think it's a big focus for the year for a lot of investors. Productive use of energy, or PUE, and we're seeing a lot of similarities, right, between the domestic solar home systems, where we saw the drastic price decrease made them much more widely available, and you guys applying the same concepts but to solar refrigeration, I think is hopefully going to put the market on its head, which is exciting to see and be a part of.
Yeah, definitely. Yeah.
We've had another question come in, and thanks everyone. Please do keep bringing the questions in from Dimitris. Could you share your feedback you received from the doctors that they've actually from the systems, if you have any direct feedback and their experience actually with the care box today, and actual direct doctor or nurse, like in the hospital, feedback that you could share if possible?
Okay. Regarding the care box, I think that they appreciate the fact that we are just one phone call away. The fact that we have control over the system from a distance. We had a little issue once. I think that the connection between the solar panels and the freezer was not, too perfect. So we received an alarm, so we rapidly called the nurses and let them know that, hey guys, something is wrong, we need to come and check it out and fix it as soon as possible. So I guess they really appreciate the reactivity. One of the nurses was telling us that they had a freezer before that was installed there, and for some reason the freezer started working and then nobody came to fix it. So, and the freezer is still there. So it's just like for decoration, I would say. So with the cooling as a service, the technical support is there. So the service is there, and we always make sure that, everything is working. That's priority.
Makes sense. And we've got another question specifically focused on a country from Paul, but I guess I'm going to broaden the question a little bit and say, how do you have plans? I mean, focus is to start within Nigeria. I know Ayula obviously has very good links within Nigeria and is from Nigeria. How do you expand this across different regions, especially West Africa or East Africa? Where does this go next? How do we scale the Koolboks into every primary healthcare facility across the continent?
Yeah, so today we are already present in 9 countries in Africa. The Cool Home, which is for productive and domestic use. So from Senegal, Ivory Coast, Liberia, Sierra Leone, 9 countries over Africa. So the idea is to duplicate the same thing with the Koolboks and expand all over Africa in the next 3 to 5 years.
Great. And will you've got a local team in Nigeria, is that correct?
Yes, that's correct. Yes. A great team. Yeah.
A very good team. The ones I've met have been great as well. Thanks everyone. Please do bring in the questions in. We've got about 5 minutes left, so we'll have a little bit more time for questions. And otherwise, I'll just fire some at Deborah myself. Just put her on the spot. Some of the questions really are focusing on how do you reach individuals who are interested without the knowledge of the product. So I guess it's how do you, on a broader scale, there's a lot of mistrust of solar across different markets within a lot of countries across Africa, unfortunately, due to poor products from the past or poor product quality, or people being sold things that just didn't do what they said they would. How do you guys ensure that your marketing and awareness campaigns, 'cause I know you do a lot of really hands-on work in the markets, especially to really educate customers, how do you bring them along that journey to believe in what you guys are doing and how that can scale?
Correct. So we are doing a lot of market activation. It's working really, really well. We go there, we have them test the product for a couple of days, weeks, so they can see it's working, they can test it. So it's not like we are coming with a product and just telling them, hey guys, you need to buy. No, they test first, they can see that it's working, and then they place the orders. So we are doing that in several markets all over Nigeria, all over Lagos, I'll say, to start with. And I mean, so far so good. The results have been amazing. Yeah.
Yeah, no, that's really nice to see. And I guess it's an interesting one because it's quite a heavy touch operation for starting with, but it's really taking people through that journey. And I think one of the things you've said to me before is how you then have champions in the market. So although it's quite a high footprint up front, you then have the people who really shout about the products and they become your biggest brand advocates. And makes a real difference.
Exactly. Word of mouth, I mean, it's the best publicity. Yeah.
Okay, we have one last question coming in. There is time for a couple more if anyone wants to throw them out there. This is a very specific question around just which country you're looking to expand into and if there's any similar companies. Specifically, Cameroon is the question at the moment, but I suppose, is there similar operations or companies trying to innovate in a similar manner to the Koolboks or the Cool Home that we're seeing in other geographies?
I know we have one competitor, if that's the question, right? Their name is Yuma. It's a Brazilian-based company. I'm not sure they have operation in Cameroon. I don't know. I'll have to double check, but I know that they are present in Sub-Saharan Africa, West Africa, East Africa. I'm not too sure about Cameroon. I'm sorry.
No, it's no problem. Okay, great. So we've got 2 minutes left, I guess. Let's leave everyone. It'd be great to know your sort of final thoughts. What do you want people to really take away? If they have one message to stick with them for leaving the call, just putting you on the spot, Deborah, sorry. What would you say is really the key message to leave them with?
Today, Koolboks, our mission is really to make refrigeration affordable and accessible. We started 1 year ago when we launched the product in the middle of the COVID crisis, and we've been amazed by the result, by the response. We double our objectives, so there is a real demand for the product. I mean, so far so good. It's a lot of work, obviously, but there's a real need. People need those products. The need for refrigeration is massive. So we want to do our part, and we want to make sure that we make it affordable to everyone.
Yeah, perfect. Thank you so much. Thanks for sharing your insights, Deborah. I think we've had a great experience working with the Koolboks team. Obviously, to date, I think they're one of the hardest working teams. Deborah phoned me at like 11:30 last night to have a chat, but they're always working very late. It's okay, but they're a really incredible team, and I think part of their focus we haven't got to touch on to is how they're really engaging also the local staff and working within the local communities to grow them together. So thank you so much, Deborah, for being the first member of our Charm Chats.
Thank you so much, Gabriel. Thank you.
No problem. And thanks everyone for dialing in. If you've got any feedback, everyone, we're always looking to work out how do we improve this. So please either go to the website and see the work we're doing with Koolboks and contact us there, or just email us directly through the details. Thanks so much, everyone, and I hope you enjoy the rest of your day.
Thank you. Thanks for having me. Bye-bye.